Hi, I'm Gail.
And hi, I'm Catherine. Welcome to Women Over 70, Aging Reimagined, our award-winning weekly podcast. Please visit womenover70.com and join our Aging Reimagined Circle. One of the benefits of membership is free participation in our online monthly programs, and plan to attend our first live symposium in LaGrange Park, Illinois on October 19, 2024. We will celebrate 5 years, 300 episodes, and so much more. Will you be among the 150 attendees? See womenover70.com for information.
And today we're excited to have in our studio Sharon Brangman, Dr. Sharon Brangman, who is a leader in the field of geriatrics. She serves as chair of the Department of Geriatrics, director of the Center for Excellence for Alzheimer's Disease, and is a distinguished service professor at Upstate Medical University in Syracuse. Last year, Dr. Brangman was elected to serve as a trustee of the McKnight Brain Research Foundation. Since 2010, Dr. Brangman has held leadership roles at the national level, including president and chair of the American Geriatric Society and the Association of Directors of Geriatric Academic Programs, serving as president from 2015 to 2017. Dr. Brangman is a widely published researcher and was the co-principal investigator on the Recruitment Accelerator for Diversity in Aging Research Project, which was funded by the National Institute on Aging. She's also been recognized for her work by American Red Cross of Central New York, the Syracuse Community Health Center, and the prestigious Ahrens Award from Syracuse University, which is the highest award given to an alum. Dr. Brangman received her undergraduate degree in biology from Syracuse University and a medical degree from Upstate Medical University in Syracuse. And she completed her residency and fellowship in internal medicine at Montefiore Medical Center in the Bronx. Dr. Brangman, welcome to Women Over 70, Aging Reimagined. Your work in the field of gerontology is really impressive, and we'd like to talk with you about some of the changes that have taken place in the field during the years you've been active and conducted research.
Well, first of all, thank you so much for inviting me. And yes, I've been in this field now for a few decades. When I started out, my patients were way older than I was, and now I'm catching up to them. So when I started in geriatrics, it was actually a new specialty. I was among the first group of people to take the board exam in geriatrics. So I'm a geriatrician, and I kind of began my professional career helping to establish geriatrics as a specialty. That meant helping get curriculum and start training programs and do all sorts of things to try to establish geriatrics in this country, because it's actually a newer specialty in the United States as compared to countries in Europe, for example. And as you may know, right now, the fastest growing segment of our population are people who are 85 and older. And that is where the intersection between aging and memory comes in, because most of the dementias, including Alzheimer's disease, is essentially a disease of aging. So I've spent a good deal of my professional time helping to diagnose and manage people who have changes in their memory. And certainly when I first started out, it was a very kind of blurred process. We at first didn't even have advanced imaging to look at the brain. We had to use very kind of crude methods to try to make a diagnosis. And that has evolved over the ensuing years to the point now where we have biomarkers that can help us make a diagnosis. And biomarkers are proteins that are in the bloodstream that can sometimes be connected to Alzheimer's disease, for example. And now we have medications that may change the course of the disease. So we've made a lot of progress. But my work with the McKnight Brain Research Foundation is really, as a trustee, helping to look at that phenomenon of normal cognitive aging so that people understand that our brains naturally age just like the rest of our bodies, and that's not a disease process. Aging is not a disease. It's actually a normal part of our life. And considering the alternative, the majority of us like to age. We just want to age well.
That's a really great way to put that. It kind of takes for sure, the stigma out of aging, right? Completely. Yeah. And
I think so.
yeah. And we know every year more people live into their hundreds.
Exactly.
Yeah. And so Alzheimer's, dementia, these are diseases that we want to avoid if we can. Is there a way to even think about doing that?
So there's increasing research that shows that, yes, we can take some control of our brain health, and that there are lifestyle changes that we can make that can reduce our risk of developing dementias like Alzheimer's disease.
Would you say more about that, please?
So, for example, there's a lot of research out there that shows that exercise is really, really important for our bodies and for our brain. And so I try to encourage my patients to incorporate a daily walk into their routine. And everybody thinks, oh, walking, how can I do that? You don't have to run a marathon. It can be 30 minutes. You could break it up into 2 15-minute segments. But exercise is very, very important. It improves circulation through the body and the brain. There's research that shows there are certain nerve growth factors that move into the circulation of our brain after we exercise. And if you combine that with some strength training twice a week, that's very, very important, especially for women to look at. And think of it as something as important as brushing your teeth and combing your hair. It should just be an integral part of what we do every day to help maintain health. We can also watch what we eat. You know, I think women in particular have been trained to worry about diet and weight and that sort of thing. But we know that diets that incorporate natural foods, by that I mean avoiding processed foods. And processed foods are usually the foods that you eat for convenience. Somebody else makes them and prepares them, and then you just heat them up. And usually they are made with all sorts of chemicals and extra salt and sugar and other things to make them taste appealing, but they really aren't good for us in the long term. And so the diets such as the Mediterranean diet, for example, which focuses on seafood and lean meats and avoiding red meat and lots of vegetables, especially colorful vegetables, as something that should be incorporated into our diet. Now, the Mediterranean diet suggests drinking wine is good, and that is one of the myths that we have all been led to believe, that drinking wine, especially red wine, it's supposed to have magical ingredients that help you age well. But there's increasing evidence that there's no safe level of alcohol for us. And that's a big problem in our country because it's so ingrained in our social activities. But alcohol is really not safe. And alcohol in and of itself is toxic to our brain cells. They actually can shrink, and we don't want that to happen. So I try to recommend that we reduce our alcohol intake. Certainly don't drink every day. Maybe save it just for special occasions if you really need to, but try to reduce or even eliminate alcohol. So exercise, a healthy diet. It's also important for us to maintain connections with people. And one of the things we learned during the pandemic, when so many older adults became isolated, they actually had a loss in their cognitive power, their brain power, because social isolation is very detrimental to our health. And screen time is okay, but it's not great. Our brains are really geared for in-person interaction. And that gets very hard for some older adults because of mobility problems, or friends may move or pass away. But we really have to work harder as we get older to maintain those social connections, whether it's volunteering or take a walk with a friend or join a book club or do something. But we have to think of ways of maintaining social connections, because those are very, very important things in terms of keeping our brains healthy.
Wow.
There's more. I can go on.
Go ahead. Go ahead.
Okay. Another thing that's very important is getting a good night's sleep. And we know as we get older, many people, especially women, have trouble sleeping through the night. And we know that as we age, we spend less time in deep sleep. You know, when they say you sleep like a baby, you can take a baby to a noisy stadium and they will sleep right through it. But as we get older, that gets a little bit more challenging. And then there's aches and pains and other things that seem to pop out at night. You can't get comfortable. But we know that when you're sleeping, the brain uses that to clear up a lot of those kind of chemical reactions that happen during the day. And so it's very important that we try to get some good sleep. And unfortunately, there's no good sleeping pill. Most of the sleeping pills are not good for our brain. And so many of my patients tell me they have a glass of wine as a way to help them go to sleep. And that may give you some initial drowsiness, but it actually interrupts a good night's sleep. So one of the things that you might find if you cut back on having cocktails or wine is that you might get better sleep. Sleep is very important.
Wow.
Do you have research or an opinion about using medical marijuana or some of the more natural aids for sleep?
So I have some patients that swear by the gummies and other things, but there hasn't been a lot of research, especially in older adults. So it's very hard for me to endorse their use because we just don't have enough information about it.
Is there planned research in the future for this?
I'm not aware of any. And, research is usually done so that you can figure out a marketing aspect in a way. And a lot of these gummies and other marijuana products are already available. So I'm not sure there's going to be that incentive to do an expensive research study unless there can be some kind of financial gain from it.
Makes sense.
Could we go back to something that you mentioned, Sharon, which is normal cognitive aging? Can you give us some indicators? What's normal cognitive aging? What would we?
So normal cognitive aging are those little annoying things that happen when you're trying to remember someone's name, and maybe you remember it about an hour or two later after the interaction is over. So as we age, our brains take a little bit longer to retrieve information. And the way I explain it to my patients is like our brain is like a big hard drive, and it has years and years and decades of files in it. And it takes longer to sort through those files and get the information that you need. So slow retrieval is actually a normal part of aging. It takes you longer to pull that information out. And in the majority of cases, you pull it out. It just takes longer. So it can be embarrassing because names are actually very hard to remember. Names used to be associated with a family or your occupation. If you were a baker, we knew what your name was going to be. Or if your father's name was John, maybe your name would be John's son. But nowadays, the names have nothing to do with the person. And tough names can be very creative and hard to remember. So a lot of times people think that this is a sign of dementia, but it really isn't. And another thing that happens is we misplace things a lot, especially if you're multitasking and you're thinking of 10 different things and maybe you break your routine. So people think, oh, I keep misplacing my cell phone, my keys, my glasses, I must have dementia. It is usually not a sign of dementia. Our brains are on overload. We get breaking news. We have the Sunday New York Times, which can be 6 inches thick. There's just so much information out there that it overloads our brains. And our brains were really made to think of one thing at a time. But our society and our culture loves multitasking. It rewards people who do multiple things at the same time. But the truth is, multitasking makes you stupid because our brains just were not made to do more than one thing. So as we get older, that gets harder and harder to do. And so then people think, oh, I used to be able to do this when I was younger. It must mean I have dementia. It does not. It means that you need to focus on the one thing that you're doing and pay attention to that. And if you misplace something, chances are you can retrace your steps and find that item. Mm-hmm. If you can't retrace your steps, or if you find the item in a really weird place, then I might get concerned.
Like the refrigerator.
Right. So I had a patient who couldn't find their dentures, the upper plate, and somehow it was in the freezer.
Oh, my.
And their daughter found it incidentally. So if you find it in a really strange place, or you don't even remember, when you last saw it and you can't retrace your steps, then I would be a little bit more concerned. But most of us are multitasking and we're not paying enough attention to what we're doing at the time. So it doesn't get established in our brains as a memory.
Is there an upside to having an aging brain?
So the upside is we have a wealth of experience and circumstances and events. Most of older patients or older adults can tell you stories of resiliency and overcoming challenges, lots of wisdom. That doesn't change with aging, and it is actually a huge asset, and it could be beneficial for younger people if they want to hear it. Many of them don't, but we carry around a world of experiences that can be shared and could be useful.
That's for sure. So, there are not a lot of gerontologists available.
I'm a geriatrician. I'm the opposite of a pediatrician.
Yeah, geriatrician.
Right.
And thank you for correcting me. And the ability for those of us who are aging, and as you said, we're going to be the largest segment, 85 plus soon. And so what do we do about that? What is our society doing about helping doctors to want to become geriatricians?
So we've been working with, wearing my hat with the American Geriatric Society. We've been working on this for a while. Mm-hmm. So we have been increasing the content of geriatrics in the training, not just of doctors, but of nurses and physician assistants and other healthcare providers, so that even if you're not a geriatrician, you have some basic skills in taking care of older adults. Just about every specialty in medicine, except for pediatrics, will see older adults. Mm-hmm. Ophthalmologists, orthopedic surgeons, and certainly internists all take care of older adults. So we have been working very hard to address this issue. It's not an easy challenge to crack, but we've been making good progress.
Well, good to hear. Definitely good to hear. Yeah. And so, right, because you go to all different kinds of doctors and they really don't look at you from the correct standpoint. They look at you, from patients who are in their 30s and 40s and 50s and 60s, and not older patients, and the aging that is natural, which I think is such an important point to keep talking about, the normal cognitive aging.
Yes, it's very important to distinguish from normal processes and diseases. And aging is not a disease, and so it's important to know when somebody actually has a medical problem and label it appropriately, but not just blame it on aging. So if you are a patient out there and some doctor or nurse practitioner or someone says, "What do you expect at your age?" Or, "This is just because you're old," that is not appropriate. It is not true. And we do not blame things on old age.
So what can a patient do to avoid that happening?
So it sometimes takes an advocate. You might need to have someone come with you to kind of advocate. It may mean you need a new healthcare provider to find somebody who takes your problems seriously and listens to you and helps you differentiate from a medical problem or not. Unfortunately, there's a lot of ageism in our culture. It's kind of built in that, where the youthful generations are the most important, and old people often get marginalized and may not be listened to. So that's another thing that we've been working very hard to do, is to help people realize that these preconceived notions about aging are harmful to people. They actually cause harm. And so we have to start recognizing when they're happening.
Absolutely. You hit upon the mission of Women Over 70, Aging Reimagined, this podcast, which is to shatter the myth that women become irrelevant as they age, which is to expand that to take in everybody who is over a certain age, who definitely are not, these people are not irrelevant. We must listen to them.
So you don't have to convince a geriatrician of that. And one of the things that we get annoyed about is they consider everyone over 65 in one big category.
Ooh.
And my colleagues who are pediatricians take care of newborn babies up till the age of 21, but nobody characterizes them in one big lump. And 65-year-olds and 90-year-olds have totally different issues and medical problems and goals of care and other things. So we do not lump people into big, massive blocks of age. You really have to look at that individual. So I have some patients who are 65 that have more physical and cognitive problems than some of my patients who are 88 or 90. So it really is an individual process, and you cannot lump everybody together.
True.
Right.
I'm just curious about, Sharon, about you were one of the first to move into the geriatrics field. What compelled you to move into that area?
Well, I enjoyed talking to my older patients and hearing their stories and their problems. And I found that my younger patients wanted a note to stay home from work, and my older patients wanted to be able to get to the grocery store on their own and not be a burden to their daughter who was working. And so I would have patients come in and tell me that they had a terrible pain in their left pinky and they needed a note to stay home from work. Whereas I would have someone in their 80s who had bad arthritis in their knees and back, and they just wanted to be able to do their laundry and do their own cooking. And I started to realize that we didn't have enough information about the healthcare of older adults. And I was in the second class of a geriatric fellowship training program that was at Montefiore Medical Center at the time. So it was definitely a new specialty. And it was very exciting to be in that place and time and help kind of shape what's going on. Now a lot of people look for a geriatrician as they get older. So people are starting to value the skills that we have, layering in what I know in internal medicine and adding in the changes that happen with aging. And so when somebody comes in and tells me, oh, I'm having a senior moment, I could not remember the name of my friend's daughter's grandchild or something. I'm like, okay, did anyone else notice it? Did anyone else have problems remembering it? What names can you remember? And then we want to talk about what your function is like during the day. Can you meet your daily needs? So for the majority of people with normal cognitive aging, they're still carrying on their lives. They're living independently. They can run their households. They can go to their appointments, keep track of medications. They can dress themselves. They're functioning, but they may take longer to learn something new, or they may take longer to pull that name out at a reception or something, and then they immediately think this must be dementia. So I'm happy to talk with people and help them understand the differences. Another big thing that happens is that we're such a pill-oriented culture that there are so many people taking pills that start to have side effects as you get older. And there are a lot of medications for sleep and other pills out there that actually can slow down your brain function. So one of the things we do in our office setting is review people's medication list to see if they're on medicines that might be slowing down their brain function so that we can make sure we can optimize their brain health. So the message is that our brains can really last a lifetime. Memory loss is not a normal part of aging. And if we make the appropriate lifestyle changes and we focus on our brain health, we can have a brain that lasts into old age. It's not normal to lose your memory. If we look at movies and television shows, more often than not, they show older people as being forgetful and cranky, and maybe they smell funny, or maybe they're hypersexualized or something that really is not the average older person. We've created stereotypes. So then people expect these things of themselves. They expect to be forgetful. And they expect to have problems with aging. And it's really unfortunate because there is a lot that we can do to age well.
And do you think this will hold for people who are living into, 110, 120?
So we have been looking at those super agers, as they're called, the people that live beyond 100. There's a lot of research to look at their brains. After they pass away, some of them donate their brains for evaluation to see what was it about their brain that helped. And it shows that they may not have as much shrinkage in certain parts of their brain. And there are other things that are going on that are helping them live longer. It's not only related to your genes. It has a lot to do with the choices you make throughout your lifetime. So we don't want people to start thinking about it just when they're 65, for example. This should be incorporated into the lifespan. And we talk about brain span because just like your lifespan, your brain can really last for your whole life. It can function well and help you stay connected for your whole life. And so that's that's the message we're trying to get out at the McKnight Brain Research Foundation, is that our brains can normally age. We are supporting research to look at this phenomenon so that we can understand it better. We certainly want to understand that intersection when somebody progresses on to more worrisome memory problems. What makes them progress while others stay in that normal cognitive aging stage? that's the focus of a lot of research right now.
Thank goodness.
And what? I'm sorry, Gail.
No, go ahead.
If you, in particular, what is your focus? What do you especially like doing research on about?
Well, I have a lot of different projects going on. We have a clinical trial program in our Department of Geriatrics where we are testing some of the newer drugs that are available for possible treatment for Alzheimer's disease. I also have grants that increase education about brain health and early identification of memory loss, and trying to train healthcare workers in identifying it so that people can get referred for an evaluation sooner rather than later. We want to have people avoid crises where things are out of control and you may lose a lot of options and choices. So some of my projects have been on that outreach into the community to do training and education on healthy aging and brain health. And then, as you mentioned earlier, I have a project that was initially funded by the NIA, and it has evolved into what we call an equity research core, to make sure that some of the clinical trials that are going on for Alzheimer's disease, for example, have representation from all older adults. Because many of the drugs that are available right now were tested in very limited populations of people. Many of them have mostly men. There are increasing numbers of women being recruited, but they're still focused on men, primarily avoiding people who are non-white. So very small representation in these trials with African Americans, Asians, Latinos. So I think that it's important when we are talking about aging, which impacts everyone, it's actually the great equalizer in many ways, that we do research that's inclusive. And so that's what I do with our equity research core, is try to increase the representation in clinical trials.
Wow. Yes. So important. Yes. So what have we not asked you, Sharon, that you should be sharing?
Well, I guess what I try to tell my patients is don't be fearful of aging. You know, all the messages that we get in our society and our culture don't really apply, and that there are things that you can do to be actively involved in your health so that you can age well. And my goal is to help people maintain the highest level of cognitive and physical function for as long as possible so that they can have the best quality of life. And we all want to figure out what our goals are in this age, in this third age, as it's often called. What are our goals? And most people want to maintain their connections with their community and their family. They want to do things that are interesting and meaningful. You know, it's kind of a standing joke that at certain cocktail parties, people will ask me what I do, and then they'll say, oh, if I ever get to that stage, just take me out back and shoot me. You know, I've heard that so many times. But in reality, I've never had a patient who told me that. When you actually get there, that's not what you want to happen.
Exactly.
Most people want to maintain that connection with the world around them.
Yeah.
They want to do things that are meaningful. They don't want to be marginalized and written off. And they often have a lot to contribute. So that's what my goal is to help people meet those goals.
That's great.
That is great. I'm moving to Syracuse.
Okay. Welcome. We'll welcome you.
I hope your practice isn't closed.
No, it is not. Actually, I've just hired 4 other doctors, and we do a lot of training of medical students and residents so that we are helping them to understand how to do good medicine. And good medicine is across the age group.
Yeah. This is really wonderful.
Absolutely.
Thank you
so much for being on our show. Thank you.
Thank you so much for having me. And thank you for having a show for women over 70. Very important.
Thank you. And listeners, because of your loyalty, our numbers do continue to grow. But still, we would like to see more of you at our monthly online programs. So join Aging Reimagined Circle and participate for no charge in these programs. And make your voice be heard and help us change the conversation about women aging. And we hope to see you in October.